Hi guys, welcome back to my channel. Today we are going to discuss about anemic disorders. So we'll discuss about two lesions. One is iron deficiency anemia and then pernicious anemia. Starting with iron deficiency anemia, it is the most common anemia of all the anemias, affecting approximately 30% of the world's population, which means every 30 people out of 100 are affected by iron deficiency anemia. Now, when we look about the pathogenesis, that is the causes of anemia, what is the etiological agents which cause anemia, we have variety of agents. One is dietary deficiency of iron, which means there is reduced intake of iron in the body or reduced intake of iron in the diet. Next, we have chronic blood loss due to menstrual, menopausal bleeding, parturition, etc. Malabsorption of iron, which may be due to malabsorption syndromes, atrophic gastritis, chronic diarrhea, etc. And then increased requirements in the case of spurt of growth, childhood, adolescence, etc. Coming to the clinical features, it usually occurs for 20 to 45 years of age and greater predilection in the case of females. Generalized pallor, fatigue, headache, anorexia, all these are common features of anemia. Lassitude. Lassitude means lack of energy or lack of mental physical weakness. Lack of wellness or physical weakness. Next there is koilonychia. Koilonychia means spoon-shaped nails. Then nails will crack and split. There is atrophy of oral esophageal mucosal membranes. Glossodynia, which means painful tongue, and atrophy of the papillae, fungiform filiform papillae of tongue. Angular cheilitis, which means there is rash formation in the corners of your mouth, with oral candidiasis. All these are some of the features. Histologically, when we see or when we look into this, we can see that the buccal scrapings of the oral mucosa will have decreased keratinizations and decreased cell diameter with enlarged nucleus. And there is karyorrhexis. Karyorrhexis means fragmentation of nucleus or nuclear fragmentation. Now, next is iron deficiency anemia. We know that in the previous slide or in the previous video, we have discussed that iron deficiency anemia is an example of microcytic hypochromic anemia, which means there is reduced hemoglobin content and the cell size is also reduced. So this is how the cell will look like. That is, the nucleus will be enlarged and the cell or cytoplasm will be very scanty and the cell diameter will be very less. MCV, MCH, MCHC all are reduced, and thus iron deficiency anemia is featuristic like that. Now, lab test or laboratory findings, we can see that the blood examination or blood test reveals hypochromic microcytic anemia, that is RBC is reduced, hemoglobin is reduced, serum ferritin levels are also reduced because the iron content is reduced. So what are the prognosis? What we can do to reduce this or how well this can be treated is that we have to give iron supplementation in the diet and then identify the cause. That is the most important thing. That is the source of the blood loss. Next, we may think as to why we have to study or why iron deficiency anemia is important in dentistry or in this field. Patients with iron deficiency anemia will have profuse bleeding or can cause complications in the periodontal and surgical procedures. So it should be done very carefully. And in patients with hemoglobin levels which is less than 10 gram per dl, the oxygen tension will be low and thus there will be ability to clot will be very less, and there is chance of bleeding, and general anesthesia should also be contraindicated. Next, we are going to discuss about a very small topic which is Plummer-Vinson syndrome. Plummer-Vinson syndrome is also called Patterson-Kelly syndrome, or also known as hydropenic dysphagia. So this was first described by Plummer and Vinson, and thus the name. So this mainly characterized by three features, important features. It has three signs, that is iron deficiency anemia with dysphagia and mucosal atrophy. This is a very important three features of Plummer-Vinson syndrome. It mainly affects the middle-aged women, and dysphagia is the most characteristic feature of Plummer-Vinson syndrome. Dysphagia means difficulty in swallowing. It can be like water, fluids, or supplements, or food, anything. So why this dysphagia occurs in the syndrome is that it mainly occurs due to muscular degeneration of the esophagus. And there is formation of webs. So what is this web or post-cricoid web formation means? They are actually thin membranes that grow in the inner parts of esophagus. So web formation will lead to difficulty in swallowing and other mucosal or esophageal lesions. So barium swallow test. This is actually used to detect or demonstrate radiographically these oropharyngeal esophageal lesions. Barium swallow means also called esophagogram. And clinical features of Plummer-Vinson syndrome includes sore throat, atrophied tongue with reduced papillae, dryness, elasticity of skin, and listlessness and pallor with dyspnea. Plummer-Vinson syndrome is dangerous. Why? Because it is a potentially dangerous syndrome because it can result in leukoplakia and squamous cell carcinoma of the oral mucosa. So that is why we have to treat this as fast as possible, as early as possible. How this can be managed is iron supplementation is usually administered or advised. Here also hemoglobin, RBC, MCH, MCHC, MCV all are reduced. Next we are going to the second lesion, that is pernicious anemia. It's also called as Addison's anemia or Burmer's anemia, or can also be referred to as primary anemia. So it is actually a type of megaloblastic anemia that occurs due to vitamin B12, which is also called cobalamin deficiency. So vitamin B12 deficiency causes pernicious anemia. So different causes or different levels of causes, that is, it can be due to dietary deficiency of B12. For example, we are not taking B12 in our diet, it can cause B12 deficiency. A malabsorption of B12 can be due to defective functioning of the intrinsic factor or due to some underlying disease of gastric mucosa. Can be due to autoimmune reaction. What does this autoimmune reaction of B12 means? That is, there is autoimmune gastritis or inflammation of the gastric parietal cells. And there is impaired absorption of vitamin B12, which is due to atrophy of gastric mucosa. And this atrophic gastric mucosa means there is lack of intrinsic factor production. And thus, if intrinsic factor is not produced, B12 is not absorbed, and thus there is pernicious anemia. And other causes means gastrectomy, if gastric mucosa is surgically removed, diverticulitis or celiac disease, Crohn's disease, all these means inflammation of GIT. So all this can cause pernicious anemia. Next we are going for clinical features. It occurs in people greater than 30 years of age. Symptom triad means there is weakness, sore, painful tongue, and numbness of extremities. These are three important features in pernicious anemia, that is weakness, painful tongue, and numbness of extremities. Then generalized features like that of anemia, like paleness, dyspnea. Then there is also neurological abnormalities in pernicious anemia. For example, there is sclerosis of spinal cord, loss of vibrations, abnormality in incoordination. Another feature is lemon yellow discoloration, which means it is mainly due to the inefficient differentiation of epithelial cells. Oral manifestations. Oral features in this anemia, we can see is glossitis and glossodynia. Glossitis means inflammation of the tongue. Glossodynia means painful tongue. Beefy red tongue means The tongue will be inflamed with small erythematous areas on the tip and margin. So redness will be there, the inflammation of the tongue will be there. There is papillae will be lost or atrophic papillae, dysphagia, difficulty in swallowing, altered taste sensation. Hunter's glossitis means glossitis in pernicious anemia. It's basically called as or referred to as Hunter's glossitis. Burning sensation or burning mouth sensation is mainly due to neuropathy. We know that there are so many neurological abnormalities, so that is the main reason of burning sensation of mouth. Next is lab findings. Macrocytosis. Macrocytosis means enlarged RBCs. MCV, MCH, MCAC all are normal. Oval-joval bodies are actually remnants of nuclei found as clusters of DNA found in RBC. Now, there is hypersegmented neutrophils, and Schilling's test is mainly used to determine the B12 absorption, whether it is occurring properly or not. It's actually a test to just check whether B12 deficiency is occurring properly. And the Hubble-Jovel bodies also indicate the damaged spleen. Then what we can do is administer cobalamin. That's the main reason. So this is the reference that I used. Hope you all like this, and thank you for watching.